In oral cancer, we face different problems in having food. Generally, this type of disease is being treated with surgery, chemotherapy, radiation therapy, or combination of these three modalities. Because of the disease and because of the treatment, these patients suffer from different side effects that hinders prevent them in having adequate amount of food. The problems they suffer mostly are taste alteration, chewing difficulty, swallowing difficulty, painful swallowing. Sometimes they find it difficult in coordinating food inside their mouth. Sometimes while eating or drinking, some part of the food or liquid may enter in their airway. These are the few problems they suffer. So main nutritional management of this type of problem is modifications in the food consistency. For example, if patient is not able to have solid food in adequate amount, then they may find it difficulty in having solid food. They may switch to softer food, or then if that is also not possible for someone to have it in adequate amount, then they have to switch to paste kind of food and then liquid. If through liquid also nutritional need cannot be met, or if patient is while drinking liquids, patient is coughing, that means some part of the liquid is entering their airway, then we may have to use tubes for feeding purpose. Feeding tubes, for example, nasogastric tube or gastrostomy tube can be used, and through that liquids can be given. We generally think that through liquid we cannot meet our nutritional need, but that is absolutely wrong. Sometimes we feel that a few liquids, for example, coconut water, fruit juices, soups are the best source of nutrition which can be taken in the liquid form. But yes, they are good. But when they are having this, patient is having this coconut water, fruit juice or soup, along with other solid food or other normal food, it's absolutely fine. But as a main source of nutrition, they are not sufficient. They lack in protein, calories and everything. So we can consider milk, lassi, dal, sattu is a good source of liquid form of nutrition. Along with that, sometimes we may have to depend on commercial nutrition supplements. Once patients are able to have solid food or soft food in adequate quantity, started having those type of food, we generally gradually reduce this food supplements, food powders. Few patients who are not able to meet their nutritional need with liquids, and those patients who are coughing after drinking liquids may need enteral nutrition support, that is tube feeding. That tube may be nasogastric tube or direct gastrostomy tube. And the liquids that patients are taking orally, those liquids can be taken through the tube. Only you have to make sure that there should not be any hard particles are there. If it is there, then tube may get blocked. While feeding through the tube, you have to remember that liquid feed should be of room temperature. It should not be very hot and cold. And you should not mix any medications with feed. And the patients who are coughing while drinking liquids orally, you have to make sure whenever they are lying down, their head of bed should be elevated above 30 to 40 degrees. These are the main things, and few long-term complications after this patients are generally suffer after completion of their treatment. Their dry mouth, their mouth becomes very dry. They are unable to have solid food. So the treatment is you have to take water with solid food. Then only you can have solid food. We have a notion that we should not drink water with food, but in presence of dry mouth, we have to take sips of water along with food. While talking also, their mouth becomes very dry, so they have to carry water always to keep their mouth wet. And another thing is, in this patient, two things are most important. First is adequate food intake. Second is swallowing exercise as shown by the swallowing therapist, and oral hygiene. These are the three key things that one has to remember to complete their treatment in a proper way without any interruption. Generally, we think the cancer treatment, surgery, chemotherapy, radiation therapies are most important, and patients are overwhelmed with these treatments only. They forgot about their nutrition, oral food intake, and they may have to stay at different place there. They cannot get their home cooked food. But nutrition is very important to complete their treatment without any interruption, and they can lead the rest of their life in a good way if their nutritional status is maintained during their course of their treatment and post treatment for a few months.